Hi guys, for this persuasive speech, I'm going to be talking about Alzheimer's disease and how we can prevent future memories. So my grandma was diagnosed with Alzheimer's in 2008 and she has since passed away, but it's a pretty close subject to me, and so that's why I think it's really important that it's just crucial that we seek medical treatment in the earliest stages of Alzheimer's so that we can have more good days with them. So throughout the speech, I'm going to be talking about what Alzheimer's is, how it affects the brain and the body, the symptoms, and then going to the doctor. So what is Alzheimer's? It's a degenerative progression of brain activity which causes the most notorious forgetfulness, and it's also a form of dementia. One thing to keep in mind is that there is no cure and that you can slow the progression, but you can't prevent it or stop it. So then how it affects the brain and the body. First off, there are plaque deposits. These slow and eventually stop the transmission of neurotransmitters, which are chemicals in our body that send signals to do things. So everyone has plaque buildup as they grow up, but everyone has the plaque buildup, but you can't be sure that it's Alzheimer's if you see these plaques, but if you have a lot, it's a good indicator. The second thing is the neurofibrillary tangles. These are caused by damaged nerve endings that result in the loss of bodily functions. So say you have a nerve axon, which is a nerve cell, and you have a neurotransmitter traveling through the cell and it gets to the end. Well, if there's a tangle here, it can't get from point A to point B. And so that's how the loss of bodily function occurs. In Ignavivius and Workman say the tangled masses of fibrous tissues and chemical changes are comparative to people with Down syndrome. So that's just kind of something to help put it in comparison or like retrospect. Lastly, it affects their personality. So there's emotional and behavioral problems like depression, hallucinations, delusions, which you can prescribe drugs for that. Greg Simon says antidepressants are often prescribed, but antipsychotics are used as a last resort if the patient is a harmful threat to themselves or others. Some of these drugs, not just the antidepressants, can help the neurotransmitters transmit signals throughout the body. So one thing I'd like to show you is that people with Alzheimer's also have atrophy in the brain. So it's the shrinking of tissue. So this is someone who has Alzheimer's. This isn't a real thing, but it's pretty close. Someone who has Alzheimer's and someone who doesn't. So at this age, they have a normal, healthy brain, very colorful. It looks like they have good blood flow. But on the Alzheimer's, you get the neurofibrillary tangles and the plaque deposits. So you have damaged nerve tissue here, and it just looks like an unhealthy brain. So now that you know how it affects the brain and the body, here are the symptoms. So of course there's the mental decline, the loss of memory, confusion, inability to concentrate. The mental decline can also impact their emotions. So they can become irritable and have personality changes. My grandma got really irritable sometimes for no reason, but now that I know this, it makes more sense. The second are the physical changes like loss of appetite, and restlessness. So once you see these symptoms, go to the doctor right away so you can get it checked as soon as possible. Going to the doctor can be kind of scary, and I'll be the first to admit that I do not like going, but when you know what to expect, it makes it a little easier. This is crucial because it can slow the progression of the disease. Drugs can be prescribed, and it also makes it an easier transition for the person and the family who is diagnosed. So what to expect? First, a neurologist or a family physician will perform the tests or whichever one that you decide to do. And there are 3 different ones. First, you can do an MRI or a CT, and these rule out other memory impairing occurrences like tumors, hemorrhages, and strokes. And then according to Diagnosing Alzheimer's, it says it can also recognize the differences between similar brain diseases, as well as being able to come up with a degree of severeness for the disease. So it may not exactly tell you if you have Alzheimer's, but it can rule out those other things. The second thing is a PET scan, which stands for positron emission tomography. I know that's really big words, but it makes sense. So first they inject a chemical called Amyvid into your bloodstream. Deborah Blacker from Mind, Mood, and Memory states, after injected into the bloodstream, the chemical will soon flow to the brain and attach to the fragments, the plaque deposits and the neurofibrillary tangles. Once attached, the chemical will show up in those areas on the PET scan. So they will be highlighted and you can kind of see how many plaque deposits and neurofibrillary tangles that person has in their brain. The second, or the last thing, is called the Mini Mental State Examination, or the MMSE. This is the most common, least evasive one. Ignovivius and Workman state, this short test assesses one's orientation, registration, attention and calculation, recall, speech, language, and reading skills through a 30-point questionnaire. So my grandma used this throughout the disease so they could kind of see how she was progressing. And so I know what you guys are thinking, that all these tests that can be super expensive, but I couldn't put a price on my grandma's life. So we've talked about what Alzheimer's is, how it affects the brain and the body, the symptoms, and then going to the doctor. Given the signs of Alzheimer's, please go to the doctor because you will be able to get those drugs prescribed to slow the progression and have more good days with them. Thank you guys for watching. If you have any questions, let me know.